several different committees now to get at this. What do you think the solution is?
Oh, I think one of the really notable achievements of this panel was the PBM legislation that they put together in a bipartisan way. I haven't met a single senator, well, actually one only, but of the 60-odd senators that I talked to, all of them talked about PBMs and how important it was. And President Trump, during his first administration, pushed through a law pushed a law to give transparency to PBMs. It got overruled during the Biden administration. Luckily, this panel is resuscitating that. President Trump is absolutely committed to fixing the PBMs.
My time is running out, so I just want to clarify. You believe that we should pass these laws that now have been proposed in the Senate?
I haven't read the entire law, so I don't know, but I think that we need to reform the PBMs. I think we need
to
get rid of all of these vested interests that are draining money from the system.
Okay, somebody suggested, though, that you thought you should convene the PBMs and talk to them about some sort of self-regulation. So I am trying to distinguish between these people who basically are doing illegal activities and ripping off, really, they're creating pharmacy deserts in my state. So I'm asking you whether you believe that we have to legislate in this area.
Again, I'm not being evasive. I just don't know exactly what the law says. I met with the PBMs. I met with pharma. My job is to meet with all the stakeholders. I've been meeting with stakeholders for 40 years. People I was suing, you want to hear from the other side.
Well,
that doesn't mean I would let the PBMs write their own ticket.
I think
I support the efforts of this committee to come up with bipartisan legislation. President Trump wants to get the excess profits away from the PBMs and send it back to primary care, to patients in this country, to high quality health care.
I'll ask you for the record, since my time's expired, to look at the legislation that came out of the Commerce Committee that defines the legal activities that they are doing to drive up prices, and get us an answer for the record. Thank you, Mr. Chairman.
In principle, I support that legislation.
Thank you. And let me just tell you the list as we have to move forward to the ending here. Senator Lujan will be next, followed by Senator Marshall, Senator Warnock, Senator Smith, Senator Young, and Senator Welch.
And let me say again, Mr. Chairman, this is a matter of such importance. A number of my colleagues would like a second round, and I think it would be important to offer, say, a modest amount of additional time to get into this on both sides. I know I have some questions. I want my colleagues to have the opportunity to raise their concerns as well.
Well, I've said, as I have indicated to you, Senator Wyden, I'm not going to do a second round. I have been very generous with the senators. I think almost every single senator has had 7 minutes at least. And I will give you a second, as is our practice between the two of us.
I'll then divide my time up with my colleagues.
Okay, you are welcome to do that.
Thank you.
Senator Lujan.
Thank you, Mr. Chairman. Mr. Kennedy, when we met, you stated to me that it is not your goal to take away programs that work for Americans. Do you stand by that statement?
Yes, Senator.
Mr. Kennedy, do you know how many Americans rely on Medicaid?
It's about 72 million plus the 7 million kids who are on chips.
Appreciate that, 72 million. Yes or no, is it important that expectant mothers and newborns have access to health coverage? Is it important that expectant mothers and newborns have access to health coverage?
Absolutely, Senator.
Mr. Kennedy, do you know how many babies born in this country are covered through Medicaid?
I would guess, I don't know the answer, I would guess about 30 million.
I have it, Mr. Kennedy. About 41% or 1.4 million babies births are financed by Medicaid, according to the National Center for Health Statistics. Yes or no, do you believe that Medicaid is a critical program?
I believe that Medicaid is a critical program, but that it's not working as well as it ought to be. And President Trump has asked me to make it work better, that most Americans are not happy with it, that the premiums are too high, the deductibles are too high,
True.
and everybody's getting sicker. Too much money is going to
Mr.
the
Kennedy?
insurance industry.
I have a series of yes or no questions. They're pretty simple. Because you heard we're not going to get a second round of questions, I ask for your indulgence to be able to get through them yes or no. In New Mexico, as you know, Medicaid is often measured state by state. It might surprise you if you look at some of those surveys. In New Mexico, the response was 90% of New Mexicans on Medicaid report satisfaction getting care, 80% getting specialist care, 85% getting urgent care, 95% ease of filings out of focus. Not to pick on any one of my colleagues, but in Louisiana, 86% of people on Medicaid are satisfied with their interactions. 83% are satisfied getting care. 85% are satisfied getting specialized care. 82% getting urgent care. I can go on state by state, but we don't have the time today. Yes or no, do you support cutting Medicaid or
Yes or no?
reducing, and especially in an area where you and I spoke about with the federal investment in Medicaid, which is known as FMAP?
President Trump has not told me that he wants to cut Medicaid. He's told me to make it better.
Do you support cutting, yes or no? Let me ask you this way, since it's only about
I
President
support
Trump.
making it better, Senator.
If President Trump asks you to cut Medicaid, will you do it?
Oh, it's not up to me to cut Medicaid. It would be up to Congress.
That's right.
Oh, and
You don't
I'm
want to
going to
answer?
work. I'm going to work.
Mr. Kennedy,
Senator.
Mr. Kennedy, you don't want to answer? I'll move on. Do you know
Wait,
how
what?
many states will end? Mr. Chairman, if I may pause my time. So I understand that people are getting asked to leave if they stand up with signs, but there's a lot of other as well, Mr. Chairman. So it needs to be extended to everyone. As Mr. Kennedy said, we should respect each other when we have a difference of opinion. We're just trying to
Emotion,
do our
boy.
jobs here and trying to ask questions. That's all. And that's all I'm doing with Mr. Kennedy, folks. So I just
Senator
hope that we can. do
Senator
that.
Lujan, you are right, and I ask the audience to please be respectful.
Thank you, Mr. Chairman. I appreciate that very much. Mr. Kennedy, do you know how many states will end their Medicaid expansion if the federal share of Medicaid drops?
Well, there's 40 states that have signed on to the expansion. So,
It's a smaller number. So it's 9 states would quickly have to end their expansion because of the laws that they have. That's about 4 million folks across the country. And in New Mexico, Iowa, and Idaho, they have triggers that it would immediately have to go into effect if in fact that gets cut. The reason I'm asking those questions is there's been a lot of chatter and conversations around Medicaid. Now, I agree we can always do better, and we must be doing better in America. But Medicaid has been shown to improve health outcomes, including mortality, quality of life, and access to preventative care as well. And there's some areas, Mr. Kennedy, that you and I touched on specific to Native American communities. One of the concerns that I have are these programs matter to folks. You shared your passion about caring for folks. I believed that passion. My question in this area is, as you know, when folks are doing research and they're going to check to see if medicine works on someone, if they're not included in that trial, it often doesn't help them. That's what all the evidence shows. So what are you going to do when programs are eliminated to require the inclusion of Native Americans in clinical trials when it comes to life-saving medicine?
I'm going to do everything I can to make sure that there's Native Americans in clinical trials. As I said to you when I visited your office, I spent 20% of my career working on Native issues. My family's been deeply involved with them. My father and uncle were big critics of the Indian Health Service, failure to deliver good health results or health care on the reservations. I'm going to bring a Native in for the first time in history into my central office, that all the major decisions in my office will be that he will have it. We've already interviewed candidate, a very, very good candidate, will have direct impact on all the major offices. One of my priorities is
You
to
know,
improve.
I appreciate that. I have a follow-up in that space specifically. Will you commit to finalizing the congressionally mandated FDA guidance to increase clinical trial diversity?
Just repeat that again. I'm sorry,
Will you
Senator.
commit to finalizing the congressionally mandated FDA guidance to increasing clinical trial diversity?
Yes.
I appreciate that. Will you commit to reinstating all of the pages that were eliminated and people that were fired from this administration that have this responsibility?
I cannot commit to that because I don't
Okay,
know who they are.
Well, there's
I'll
some
commit
folks
to
out there doing the
working
work.
with you to make
Mr.
sure
Kennedy-
those positions are adequately staffed.
I will follow up in writing in those specific areas because I think there's some commonality here, but answers matter. And so I'd like to get those as timely as
up.
possible. The last thing, Mr. Chairman, that I'll say is one of the conversations I had last before this hearing was with a family that I've been working with to work with my Republican colleagues when it comes to autism and federal programs and making a difference in these families' lives and this little girl's life. What I'm asking now, Mr. Chairman, is unanimous consent to enter into the record an article from Autism Speaks titled, quote, "Do Vaccines Cause Autism?" End quote. And I'll note that the first sentence states, quote, "Vaccines do not cause autism," end quote. Thank you. I yield back.
Without objection.
Well, that's a
And
fake
before we
study.
move on, we've had a request from several quarters for a quick restroom break. We will take a 5-minute recess. I'm sorry to those remaining 5 or 6 senators who must wait a few minutes, but we will have a quick break. We will be back as soon as we can.
Good morning. Well, you see there are a lot of people. Rfk Jr. has a lot of support right there. So even though you see those Democrat senators being so hostile to him, I think we see that the mandate from the American people is on full display right there in that Senate hearing. Rfk Jr. has a lot of support there. So, and he's answering the questions well. But what I noticed they're doing with him is because he's so well versed in science. A lot of those folks there in the Senate, especially on the Democrat side, man, it's just so sad. A lot of those who are so hostile towards him, it's like their answers come off sounding, well, their questions, they come off sounding so ridiculous because they don't even understand. In one question that was asked of Rfk Jr., it's like the guy didn't even understand that it has nothing to do with Rfk Jr. It's Congress's job. Like, so it doesn't make sense. And then Bernie Sanders, I'm sorry, Bernie is such a disappointment, bro. Like, and I used to be a Bernie supporter when I was quote unquote a Democrat, just to see how Bernie has just basically become this joke. He's like one of the biggest. I think Bernie Sanders is going to go down as one of the biggest political failures in the history of this country. He sold out an entire movement, a populist movement that he created, and he just threw everyone who supported him under the bus in service to the establishment. So Bernie has no relevance here. So for him to go into that Senate hearing trying to act like he's this champion for the people with the same old ass, dumbass talking point, do you believe that healthcare is a human right? That is who's going to pay for it? I mean, I get it. It sounds good, right? But yes, I think everyone has the right to pursue the health care that they want, right? But there's certain arguments. I think an argument that Rfk Jr. offered was like, well, if you're a smoker, a chain smoker, and you're told, please stop smoking, and you smoke for 40 years anyway, and then you get sick or you get cancer, does that mean now it's everyone else's responsibility to pay for it for your decisions? So that's a nuanced issue. So I get what Bernie's trying to say, but Bernie, stop it. Because what you're doing is you're just basically arguing for socialism. Like, and it's entitlement. It's politics of entitlement. And you know what? When when you stand as an independent, it's easy to see the hypocrisy on both sides, right? It's very easy to see that hypocrisy. The only problem that I seem to find is whenever I try to talk about these issues, whether I'm dealing with the left and I criticize the, leftist policies, or I'm dealing with the right and I'll criticize policies on the right or Republican policies, you get uniformly attacked. And that's the problem with our state of politics. We got to get better. Like, we really have to get better and stop buying into the hyper partisan, bipartisan, two-party idea of politics, which is controlled. You know what I'm saying? And hold on, let me see this. Yeah, and it's so crazy isn't it crazy how hostile they were? So Roxanne says, yeah, and they were treating this like an interrogation instead of an interview where they should be allowing him to answer the questions. And that's the thing. I always talk about this. If you're really asking someone a question and you want an answer, like if you're asking good faith questions and you want to actually get an answer, right? If you want an answer that the American people can hear and understand, you're going to let him articulate his response. But what I notice is the overwhelming majority of questions that were asked to RFK Jr. were framed as yes or no. We understand the need for context. Now, the difference is when I watched like the Senate hearings that you would see with Mayorkas and Merrick Garland, Anthony Fauci, and others, there's one thing I always notice. They were asked a whole bunch of questions. And even when they were allowed to elaborate, all they did was dance around. They danced around the answers. They never actually answered the questions. But then the difference that I've seen in these confirmation hearings for Donald Trump's appointments, they've been answering them questions. They have been answering them, and they've been providing context in their answers. So when I see someone trying to pigeonhole you into a corner with an excessive series of yes or no questions, I understand there's a need for nuance, that there's a need for direct answers. But when every question is framed yes or no, yes or no, yes or no, they're trying to walk you to a specific conclusion, or they're trying to walk those listening to a specific conclusion that just simply could be completely detached from whatever it is. So let's get back to the hearing and let's see those questions that they're going to start asking once again.
Bursts earlier, but I want to thank the audience for being respectful and encourage the audience to continue to be respectful as we conclude the hearing. With that, Senator Marshall.
Thank you, Chairman. Obesity, diabetes, heart disease. Obesity, diabetes, heart disease account for probably 80% of health challenges in America. You know how many times I heard my friends across the aisle mention any three of those? I don't know if we've lost the forest for the trees here. Vaccine is a critical issue. I understand that. I don't see how Mr. Kennedy's position could be any more clear that he's going to support the vaccines. He's going to support the science and empowerment to parents and their doctors to make these choices. 60% of Americans have a chronic disease, that there's an epidemic of chronic diseases across the country. And this Make America Healthy Again movement is palpable to me. It started on the campaign trail in 2020 when moms I'd never met, that never involved in the political process, came up to me and said, look, I want to make these choices about my children with my doctor, not the federal government. That it's a very real thing. Moms, dads, grandparents across the country grab me and say, look, why do 20% of our children now, why are they on a prescription drug? So, Mr. Kennedy, what is your prescription to help make America healthy again? What's your vision? What does that look like to you?
Thank you, Senator Marshall. We're having epidemics of all these chronic illnesses, autoimmune diseases, neurological diseases, allergic diseases, obesity. When my uncle was president, 3% of Americans were obese. Today, 74% of Americans are obese or overweight. No other country has anything like this. In Japan, the obesity rate is still 3%. And epidemics are not caused by genes. Genes may provide the vulnerability, but you need an environmental toxin. Oh, something is poisoning the American people. And we know that the primary culprits are our changing food supply, the switch to highly chemical intensive processed foods. We have 10,000 ingredients in our country, in our foods. The Europeans have only 400. If you buy McDonald's French fries in our country, there's 11 ingredients, my understanding. In Europe, there's only 3. If you buy Fruit Loops in our country, they're loaded with food dyes, with yellow dye, red dye, blue dye, and many other ingredients. The same company makes the same product with different ingredients for Canada and Europe. And at age, we don't have good science on all these things. And that is deliberate. That's a deliberate choice not to study the things that are truly making us sick, that are not only contributing to chronic disease, but to mortalities from infectious disease. We need to get a handle on this, because if we don't, it's an existential threat. Our country is not going to be destroyed because we get the marginal tax rate wrong, or because we get one of these culture war issues that we've been talking about today wrong. It's going to be destroyed if we continue down this trajectory of chronic disease. We need to fix our food supply, and that's the number one.
Thank you, Mr. Kennedy. Certainly, I share your concern with ultra-processed foods. On the other end of this food chain are my farmers and ranchers back home. Would you just take a second and share your compassion, how you feel about farmers and ranchers, that they respond to the market? They don't dictate the market. They grow what the market is wanting them to grow.
Good question.
Senator Hawley told me the other day that his brother-in-laws are all farmers. And he said 4 out of every 5 of his brother-in-laws has Parkinson's disease. And that kind of cluster we're seeing across farm country of cancers, autoimmune diseases, obesity, et cetera. Oh, and we can now not export American food to Europe because the Europeans won't take our food. That's not good for farmers. We're also destroying our soil because some of the chemicals that farmers use destroy the microbiome, and that causes the erosion of the soil. You can't get water infiltration. Water pools up and it washes the soil off. Agronomists now estimate that we only have, if we continue doing these processes, only 60 harvests left before our soil is gone. So farmers are using seeds and chemicals that are, over the long term, are costing them and us. And what we need to do is we need to support the farmers. We need the farmers as partners if we're going to make them work. And I don't want a single farmer to go out of business under our watch. I don't regulate farms. If I'm privileged to be confirmed, I'm not regulating farms. That's under USDA. But I want to partner with all of my decisions with USDA and with the farm community to make sure that we don't lose more farmers in this country, but that we also transition. We offer and incentivize transitions to regenerative agriculture, to no-till agriculture, and to less chemically intensive. And by the way, I've also met with the chemical industry and the fertilizer and herbicide companies, and they want to do the same thing. Oh, and I think we're on the trajectory to do that, and we need to incentivize initiatives to accelerate that trajectory.
Mr. Chairman, if I could, the great news is that my farmers in Kansas
Excellent answer.
are selling
Excellent.
products to Europe, that today's regenerative practices soil health, all those things are priorities for Kansas farmers. Many of us are doing many of those things already. We just need it to be more widespread. If I could just wrap up my remarks, though, is that, again, going back to the big picture here, 60% of Americans have a chronic disease. Mr. Kennedy, I believe for such a time as this, that you're not just one of 300 million people. I think that you are the person to lead HHS to make America healthy again, that God has a divine purpose for you. And I look forward to your confirmation and working with you to make America healthy again.
Thank you, Senator.
Thank you.
Well done. That's how you do it.
Senator Warnock.
Thank you so much, Chairman Crapo and Ranking Member Wyden. It's great to be here. Mr. Kennedy, welcome. Welcome to you and to your family. Thank you for meeting with me a few days ago. I'd like to follow up, if I might, with some of the issues that we discussed in my office. I want to talk to you first about the CDC, or the Centers for Disease Control and Prevention. I'm proud of the work that the CDC does, proud that it's located in Georgia with more than 10,000 employees in my state.
Bad start.
If confirmed, you would be the cabinet secretary over the CDC. Representing HHS is about 29% of the federal budget. CDC is a part of that. Do you agree that the CDC's work is critical to Georgia, critical for our country, and the health of the entire world?
Yes, Senator.
Senator Isaacson, my Republican predecessor, would have agreed with that. Bless his memory. He was a fierce advocate for the CDC, as am I. The CDC is an agency filled with hardworking
Liars who lie to the public.
They wake up every single day working to keep us safe. I think we don't think often enough about their work, because it's easy not to celebrate the folks who are protecting you from that which doesn't appear because of the work that they're doing. So grateful for the work that the CDC employees do. Some of them are members of my church. I saw that deep commitment firsthand when I visited the CDC just last summer. Mr. Kennedy, you have compared the CDC's work to Nazi death camps. You've compared it to sexual abusers in the Catholic Church. You've also said that many of them belong, this is a direct quote, many of them belong in jail. For me, those are disturbing characterizations of the CDC workers that I know who are trying to keep the
Why? It's true.
day. And as you are presented as the nominee for this position, I need to know, do you stand by those statements that you made in the past, or do you retract those previous statements?
Senator, I don't believe that I ever compared the CDC to Nazi death camps. I support the CDC. My job is not to dismantle or harm the CDC. My job is to empower the scientists if I'm privileged to be confirmed.
So you retract those statements?
I'm not retracting it. I never said it.
Well, actually, I have a transcript
Of me saying that it's a Nazi death camp.
Let me read your words. It says that the institution CDC and the vaccine program, is your description of their work, is more important than the children that it's supposed to protect. And you know, it's the same reason we had a pedophile scandal in the Catholic Church. It's because people were able to convince themselves that the institution of the church was more important than these little boys and girls who were being raped. That's pretty provocative language. You said
that's true.
In another statement to me, this is like Nazi death camp. I mean, let me finish. I'm just reading your words. I mean, what happened to these kids? 1 in 31 boys in this country, their minds are being robbed from them.
Yeah, I was not comparing the CDC to Nazi death camps. I was comparing the injury rate to our children to other atrocities. And I wouldn't compare of course, the CDC to Nazi death camps to the extent that any statement that I made has been interpreted that way. Yeah, I don't agree with that. In 2003, the United States Congress Government Oversight Committee ended an over a year investigation of the CDC and used almost that same language. They said that the CDC, just one division, one branch, the Immunization Safety Office, had put institutional self-interest and pharmaceutical profits ahead of the welfare and health of American children. So that was a conclusion by Congress. And I repeated
Well,
that.
I'm asking you because you're the nominee for HHS. It sounds like you stand by those statements.
Senator, my objective is to support the CDC.
I would stand 100% by them damn statements because it was true. Look up Dr. Robert Redfield, the former CDC director before Walensky.
From that same Government Oversight Investigation Committee found that the panels, the ACIP panel within CDC, I think 97% of the people on it had conflicts. I don't believe that that's right. I think we need to end those conflicts and make sure that scientists are doing unobstructed science.
So I want to enter this statement, by the way, into the record without objection.
Without objection.
Last week, the White House gagged HHS and the CDC, preventing them from communicating all important public health information to anyone, including all of our allies, including our allies in the United States and global disease prevention. Can you just answer yes or no, because I'm running out of time? Do you agree with that action?
Yes.
I was not consulted on it, but that's pretty much standard
I'm asking
operating
you,
procedure for incoming administration.
So you agree with the action that gagged HHS and CDC from communicating important public health information to the
That
public?
directive made sure that no
You said,
public health and only non-essential travel and mass communications were temporarily suspended
During the
pending
transition.
pending the confirmation of a new HHS secretary. This is standard operating procedure for
I
every
get it.
administration.
I get it. I don't think what we've seen over the last
You see what I mean by disingenuous framing?
operation for new administration. I think we're seeing some unprecedented actions, but you agree with it. Last night, members of the CDC, along with other federal employees, were actually invited to resign, these buyouts. And I got text messages and folks I know work from the CDC, for the CDC,
Good.
that do this important work,
Please.
who got that note. And it's really important because my experience is that when you send out that kind of note, the folks who resign are the folks who you least likely want to see resign. They got other options. They're gifted folks. They got a lot of expertise. They have options. A lot of them are doing this work.
Oh, he's campaigning for, he's trying to get the members of his church, get them to keep their jobs so they can continue to put money in the offering plate.
At the
Because this dude got to be a preacher.
at CDC are patriots and good government servants.
Can you tell me yes
I don't
or
think
no?
anybody's going to resign who's committed to making America healthy
Can you
again.
just answer yes? Okay, you agree with the buyouts. In our meeting, I asked you to confirm your support for the Affordable Care Act. You also mentioned that you and President Trump want to fix the ACA by making premiums more affordable. Can you answer me yes or no? As I don't have a lot of time. Did you know that tax credits that help families afford health insurance and save Georgians an average of $531 per month per person are set to expire at the end of the year? Did you know that?
I do.
We need to move on.
Do you support Congress extending these tax credits so that Americans can continue to afford health care?
Congress has to make its own decisions about that. My instructions from
Mr.
President
Chairman,
Trump.
you're saying I'm running
is
out
to
of time,
make
but I'm having a lot of trouble
Let the man
getting the
answer,
witness to
fool.
answer yes or no to a yes or no question. And
Well,
I've got one more question.
you're almost at 9 minutes. sir.
Well, I need him to answer yes or no. Yes or no? Do you
I'm not going
support?
to answer yes or no to a question that's not susceptible to an honest yes or no answer.
Okay, I can't
We
get
need to
this.
move on.
Thank you. Thank you.
I think that the fact that you find it difficult to answer basic questions
Oh.
is deeply troubling for me as you present yourself as a nominee to to run HHS. Thank you so very much.
Senator
You know,
Smith.
I've been in courts all over the country and prosecutors.
Mr. Chairman, you told me I'm out of time and
Yeah,
the
right.
witness continues to filibuster even after I said I'm done.
Bro, this is the theater of politics. I just want you all to see this.
Kennedy. So, Mr. Kennedy, I don't have a question for you on abortion. I think that my colleagues on both sides of the aisle have covered this, but I want to say I can respect people who have different views than mine on this issue, but it's hard for me to respect people who won't give a straight answer to what they think on this issue in particular. Mr. Chair, I just want to note that I understand that anti-choice advocates have said that in these hearings, they were looking to hear Mr. Kennedy provide some reassurance that he is on their side, and I'm not hearing that. And I think most Americans are looking for some hint that the decisions that people make about abortion should be personal and private, and they should be free to make those decisions without government interference. And I'm not hearing that either. To make it worse,
He has nothing to
the
do with that.
answers that you have given tell me that the Trump administration is more than willing to restrict or even ban medication abortion without a single act of Congress, and even in states where abortion is legal. And what is clear,
Just so you guys know, those abortion pills, they have a significantly higher mortality rate than a lot of people understand. They're actually quite dangerous. But I'll pull up the Senate hearing so you can hear about it.
I know that you and your family have had personal experience with mental health challenges, as have I. And I agree that the mental health crisis in this country is a crisis. So let me ask you, in an interview in 2023 and again in 2024, you blamed school shootings on antidepressants. You said, and this is a quote, "There is no time in American history or human history that kids were going to shoot schools and shooting their classmates. It really started happening coterminous with the introduction of these drugs, with Prozac and with other drugs." So do you believe, as you've said, that antidepressants cause school shootings? This should be a simple question.
I don't think anybody can answer that question, and I didn't answer that question. I said it
So
should
your
be
answer
studied.
is,
I said it should be studied along with other potential culprits
so
like
they may cause.
social media. Yeah, but I don't know. I would never make, because there's no science on that.
Well,
Senator.
there is, Senator, excuse me, there is, Mr. Kennedy.
Thank you for the promotion.
The science shows that there is no link between school shootings and antidepressants. And in fact, most school shooters were not even treated
What?
with antidepressants. And of those that were, there was no evidence of association. You know,
I don't think you
My
can say
question
that,
is-
Senator, because of HIPAA rules, nobody knows.
well, that is Mr. Kennedy,
Very smart.
who take antidepressants are dangerous.
I think, listen, I'm not going into HHS if I'm privileged to be confirmed with any.
So you can't say that people
To
who.
impose any preconceived ideas that I may have. I just want to have
Okay,
good science.
So you're not saying that they aren't dangerous, which means that they could be
I've said-
dangerous. Let me ask you this.
That's not true.
You've described Americans
Oh
who
my
take
God.
mental health medications as addicts who need to be sent to wellness farms to recover. Is that what you believe?
No, of course, I didn't say that
Yes, you did.
anybody should be compelled to do anything.
No,
I'm
but you
for-
said they should be sent. There,
I
you
said they should
described
be
folks-
available to them.
You
I
said
didn't
that-
say they should be sent.
You said that folks
Kicking and
that take
screaming.
antidepressants are like addicts. That I can provide that.
Oh, I
Mr.
think they
Chair.
should have the availability. Listen, I know people,
So-
including members of my family, who've had a much worse time getting off of SSRIs than they did, than people have getting off of heroin.
Well-
It's the withdrawal period is, I mean, and it's written
actually have
on the
s-
label.
I have some
This is very
experience
well
with this
documented.
myself, Mr. Kennedy. This is personal for me. When I was a young woman and I was struggling with depression, thankfully, I had the resources to help me get through it.
You didn't get through it.
Including
You clearly didn't get through it. Listen to you now.
which helped to clear my mind, get me back on track to being a mom and a wife and a productive, happy person. And I'm really grateful for that therapy. So I have some experience with this.
And this is why, according to a Pew Research study, 62% of white liberal women today are currently diagnosed with a mental illness.
You say, Mr. Kennedy, they live on, they have impact. And, you know, we're having this conversation at the same moment that my Republican colleagues are looking to try to figure out how to save money any way they can. And so they want to cut Medicaid. Let's just think about this for a minute, because you're going to be, should you be confirmed, you would be responsible for CMS, which provides mental and behavioral health care to millions of Americans. Close to 40% of folks on Medicaid have a behavioral health condition. And you would be part of this administration that would be looking to cut Medicaid. So, Mr. Kennedy, these statements that you've made linking antidepressants to school shootings, they reinforce the stigma that people who experience mental health every day face every single day. And I'm very concerned that this is another example of your record of sharing false and misleading information that actually really hurts people.
Name one.
Senator, you're
Thank you, Mr.
mischaracterizing my statements.
I am only putting into the record what you have said, Mr.
You're
Kennedy.
mischaracterizing my statements, and I'm happy that you had a good experience on SSRIs. Many Americans have very good experience on it. Others have
That would
not.
be an issue between them and their physicians, and not for
And
the
exactly.
head of HHS to be just putting out
Oh, so then that's their problem.
of SSRIs and other antidepressant medication, spreading the stigma and the fear that we're actually trying to overcome.
Do you think physicians, when they make that prescription, ought to have access to good science?
Of course they do. And
Right,
I don't
that's all I
think that,
believe too. Then you and I are in agreement, Senator.
and to your point that you made when you made these statements, it was not based on good science. I don't know what it was
I
based
was saying
on.
the science needed to be done. I was saying these are potential culprits. We're coterminous, and I named other things. I said video games. I said social media. I said SSRIs. SSRIs have a black box warning of suicidal,
Mr.
homicidal
Chair,
behavior.
Mr. Chair,
Yeah, now you cut him off when he talks about warnings for suicide, right?
what Mr. Kennedy has said of linking antidepressants to school shootings. Thank you.
These people are demonic. Real talk.
Chairman, good to see you, Mr. Kennedy. To follow up on that spirited exchange, in talking with you and reading about your vision for the department, you said one of your goals is to return public health agencies to the gold standard of scientific review. You've alluded to the gold standard a number of times today. So I'm going to give you an opportunity, uninterrupted, but hopefully not too extensive, to tell me and others what you mean by this gold standard.
Means real scientific research with replication of studies, which very rarely happens now at NIH. We should be giving at least 20% of the NIH budgets to replication. We should make sure that all the science is published with the raw data. We should make sure that the peer reviews are also published. And I'll give you a quick example. 20 years ago, NIH scientists did a study on Alzheimer's, which they said it was caused by amyloid plaque. After that, NIH shut down studies of any other hypothesis. 20 years later, we now know that those studies were fraudulent. NIH has funded 800 studies on a fraudulent hypothesis. And we've lost 20 years in figuring out a cure for Alzheimer's. And that's just one example. I could give you hundreds. We need to end that. We need to end the old boy system. We need to have replicatable science and be completely transparent about raw data.
Thank you, sir. In recent years, particularly during the COVID pandemic, there's been a lot of skepticism about our public health institutions. Some of this, I would say, is warranted, but it's now created a pervasive lack of trust from the public that these institutions are acting in bad faith or failing to act in objective criteria, failing, in short, to act in the best interests of the public. If confirmed, Mr. Kennedy, how will you work to regain the public's trust? I suspect it'll take some time in these important public health institutions.
I'm through radical transparency. I'm going to make the reason people don't trust the public health agencies is because they haven't been trustworthy. And you gave the example of COVID. At the beginning of COVID, everybody was rushing to get that vaccine. We had over 90% vaccination uptake.
Yes, sir.
CDC's most recent recommendation is that Americans take the 8th booster. Only 23% of Americans are complying. That means 77% of Americans no longer trust CDC, and that is the problem.
Yes, sir. In the absence of full information, might it, I think agree with you, but I want your response. Might it make sense to share that absence of full information with the American people, that uncertainty? I think one of the things by observation and experience that I saw during the pandemic, because we had certain prominent doctors appear on television
Speak
and
about it.
indicate, no, you absolutely must not wear a mask. 2 weeks later, it's yes, you must wear a mask. But they were certain. And they even demonized people for not following the latest science, knowing there's a high level of uncertainty in that science. Would a measure of humility, and as you say, radical transparency demonstrates humility, help rebuild trust over a period of years?
Absolutely. We need to tell Americans what we don't know. We need to make sure studies that reach a null hypothesis are also published. And that doesn't happen.
Sir, I think you are right about why healthcare costs are so high in the first place. The answer is indeed chronic disease. 90% of our healthcare spending goes towards managing it, as you say in your open statement. It's not in the main because of waste, fraud, and abuse, although we know some exist. It's not in the main because we have greedy executives at innovative world-class companies. It's not in the main because we haven't yet adopted an unsustainable Medicare for all scheme. It's because of this. So I'm encouraged that you intend to make that a point of emphasis as it pertains to your future leadership. I will say, with respect to COVID, it's not over for a lot of Americans. It's not over. I know the mission accomplished banner was convenient for the last administration, but as we continue to navigate the ongoing impacts of the COVID pandemic, we have many individuals here in the United States and around the world who are suffering from long-term health effects that significantly impact their quality of life, work, and daily activities, and they've been largely ignored. Funding for long COVID research was appropriated by Congress in December of 2020, followed by additional funding directed by the Biden administration in February 2024. Patient groups and industry publications have criticized the slow pace of clinical trial design and enrollment. If confirmed, will you collaborate with healthcare providers, researchers, and effective communities to better understand and mitigate long COVID's impact? Yes or no, please?
Absolutely, Senator. There's 16 million Americans.
Will you commit to prioritizing long COVID research and integrate this work into broader healthcare policies? Yes or no, please?
Yes.
Patient groups, experts, and industry publications have raised concerns around existing long COVID funding being spent on observational research. In particular, criticism was directed towards recover funding being used to duplicate existing findings instead of funding trials for potential treatments or diagnostics. If confirmed, Mr. Kennedy, will you work with Congress so that going forward, long COVID funding will be directed primarily towards trial or novel research directions and not replicating existing observational research? Yes or no?
Absolutely, Senator, with enthusiasm.
Thank you so much. If confirmed, how will you create a balance between your personal priorities of chronic disease and healthy lifestyle and the ongoing critical work of the department in areas that are focused on incentivizing and advancing innovation in modern medicine and pharmaceutical discovery?
I think innovation is going to be the key to public health. And we have a unique opportunity now in history because of AI, because of telemedicine, and because of the quality of people that are now coming to HHS to actually save public health. But it's all going to rely on innovation. And I don't want to do anything that inhibits or impairs the pace of innovation.
That's encouraging. From approving AI algorithms to determining Medicare coverage, we certainly need more innovation, and we need good people in the department to assist with that effort. So I'll follow up with a question about how you're going to attract and retain good people. Thank you, Chairman.
Sorry to shut you down a little faster than I did the others, Senator Young. We are up against a vote deadline here, and we have one more senator who gets his full time. I hope you'll keep it as close to 5 minutes as you can, Senator Welch. And then I've promised Senator Wyden, 5 more minutes?
To be divided 1 minute with my colleagues getting 1 minute.
And then if we can do that, we can get over to vote before they call the vote on the floor.
Thank you very much. Thank you, Mr. Kennedy. And as you know, I'm have great reverence for your family from Massachusetts. When I got out of college, I was in the first class of Robert Kennedy Fellows, the memorial created by your family to honor the service of your father. I do community organizing in west side of Chicago. And I certainly admire your energy in your effort here and desire to serve. You know, there's a couple of things that are really important here. This is not just about a debate on vaccines. It's a debate about qualifications, experience, and priorities as to the person that will head Health and Human Services. And it's not just about what your answers are today or what the questions are. It obviously has a lot to do with your whole record and your whole history. You know, your sister in her letter, or pardon me, your cousin in her letter said, you've always been charismatic, able to attract others through the strength of your personality, willingness to take risk and break rules. That's, I guess, an attribute, but it can be a danger. The question I fundamentally have is whether your willingness to disrupt and maybe break rules is going to be dangerous and destructive. The character questions we didn't go into here, but there's some sketchy things. You've acknowledged your history with heroin. You've gotten over that. But there's incidents that do, I think, concern the question of whether the stability is there to be in charge of this major organization. And that's compounded by my concern that you don't have any experience managing a large organization, that you don't have any experience in government. So those are things that have to be taken into account.
That was
But
wild.
the issue for me is also priorities. A lot of your engagement in health has been on vaccines, big important issue. You actually disagreed, as I understand it, with President Trump about Operation Warp Speed. I think President Trump deserves a lot of credit for Operation Warp Speed. He knew we had to get a vaccine. And these other issues about a mask and whether you should wear it, whether when you got your groceries, the bag had to be left outside. Remember that in the very beginning? Those are incidental to the core question that the president believed we had to have a vaccine. And you contested that. That worries me. That really deeply worries me. The other questions, Senator Cassidy asked you some questions about our healthcare system. I happen to believe that.
Such a disingenuous framing.
And it's not just about the chronic illnesses. That's about our diet. That's about our exercise. But we are getting premium increases in Vermont of 20% a year, 25% a year. And it's busting the bank for taxpayers. It's busting the bank for our wonderful Vermont employers who care about having health insurance that they can provide to their employees. Senator Cassidy asked you a couple of questions about how you would reform Medicaid, and I didn't hear an answer. You mentioned that you thought Medicare Advantage was good. You have a good plan. No focus on what an incredible ripoff was reported in the Wall Street Journal by United Healthcare, which was marketing Medicare Advantage and then paying doctors and nurses where they had assignments essentially to diagnose illnesses that didn't exist. So they made billions and billions of dollars.
What are you talking
And
about?
I've seen nothing coming out of the Trump administration, and I've seen nothing coming out of your advocacy that is going after what is a rampant abuse by the insurance companies and overcharging people and not doing the job. And by the way, the United Healthcare people, when they did that, they overdiagnosed. When the person really got sick, they dumped them. They dumped them. Go to the nursing home on your own. That's a broken healthcare system. We spend the most and get the least. And I think there should be collective anger about this on both sides, because all of our people are dependent on that healthcare system. And you're going to be working for a president who's on a lawless rampage right now, okay? He has done something reckless with the pardons to these cop beaters. I'm appalled by that. But that's just reckless. That's not illegal. He's impounded money. So right now, the Medicaid website went down. He's impounded money. So the community health centers that Senator Warner was talking about,
Senator, let me answer the question about Medicare first. I have never defended that program or the rapacious behavior by insurance companies or the PBMs. I understand that's a huge problem. And
all right, I don't have time. We've got to get over to vote. So we can do this.
But you've asked me 5 questions. You got to give me a chance to answer one of them.
Right. Yeah. What the hell?
Yeah. I mean, I brought in, if I get confirmed, I've already appointed a general counsel. It's the first time in history, he's a former prosecutor who prosecuted the biggest Medicare fraud in the case in the state of West Virginia.
Pfizer.
I brought in a prosecutor for that job instead of a bureaucrat, precisely to address the important issues that you raised here. The only reason I didn't talk about these before is because I wasn't asked about them.
What about-
I agree with you 100%.
All right, what about impounding, a president impounding money that,
Yes.
among other things, goes to healthcare?
And you're saying that that's illegal?
That's correct.
Well, my job is to uphold the Constitution.
That's false. The president has impoundment authority. I think that's the Impoundment Authority Act of like 1974, I believe.
Constitution.
Thank you.
Mr. Chairman, I believe under what we've discussed, I control 5 minutes. I'm going to take one and give one to each of my 4 colleagues that remain.
All right, and I would just say this vote, they're going to call it in about 8 minutes.
Thank you.
So we have very little time.
2 hours ago, colleagues, I asked Mr. Kennedy to reconcile his many anti-vaccine statements with his handful of pro-vaccine statements. Instead, he gave us a word salad and ducked the issue. The same was true, Mr. Kennedy, with respect to measles, where you wrote a book playing down the threat, of measles, even though American families are very concerned about it. And apparently families are still mourning in Samoa. And my last point would be that Mr. Kennedy said today really wasn't about him. And I just want to tell him it is all about you, because I find your presentation to be both untrustworthy and unprepared, because my colleagues have been seeing back and forth between Medicare and Medicaid, and it's not clear which program you're using when. So I want colleagues to know there is a lot more information to learn about Mr. Kennedy before we vote. I'm going to urge that to my colleagues on both sides of the aisle to not make.
Yeah, you guys need to primary this dude, whatever state he's from. You need to primary this guy because he's unhinged.
Senator Whitehouse, Senator Warren, and Senator Smith.
And again, 1 minute each, please.
Senator Warnock.
There's been a
Excuse
lot
me.
of conversation about
Make testosterone great again.
it clear what Rhode Island OBGYN doctors describe as what is almost always happening when a late-term abortion is needed. It is a childbirth gone wrong. The family has painted the room. It has bought the crib, maybe even decided on the baby's name, and has gone to the hospital.
Oh my God, this is sick what this guy's about to say. I can already feel it coming.
A happy event. And then things went wrong. Then the alarms started pinging. The lights started flashing. The medical professionals started rushing in. And the question became, who lives and who dies? The mom's life is often at risk.
There is no state in the United States that does not allow for late-term abortions if it threatens the life of the mother, for all of those who are interested in actual factual information.
May die. In that environment, the doctors and the family own that decision. Government has no place in that room at that point. And I think we need to understand, when this late-term abortion gets bandied about, what you're dealing with is a tragedy that is happening to a family who wanted that child and have suddenly been confronted with a moment in which they have to make what is probably going to be the worst decision of their lives. And to try to shove the...
Do you all really want to listen to this word salad of virtue signaling by this evil person who is trying to convince you how good it is to kill your unborn child? Like, is this what we're doing now? These are Democrat politics? Y'all cool with that shit?
Boyd.
Senator Warren.
Thank you, Mr. Chairman. So, Mr. Kennedy, I wanted to ask about your role in the 2019 measles outbreak in Samoa. In July 2018, 2 children died immediately after receiving a measles vaccine that nurses had mistakenly mixed with a muscle relaxant. The nurses get charged with manslaughter, but vaccination rates go down. I asked you about this in my office. You told me flatly that your visit to Samoa had nothing to do with vaccinations. We now know that's not true. I have the documentation. You met with the prime minister. You talked about vaccinations. You met with an anti-vaccine influencer who described the meeting as, quote, profoundly monumental for this movement. So what happens? Vaccinations go down. There's a measles outbreak and children start dying.
Oh my
but
God.
You double down. You didn't give up. Just 4 days after the prime minister declared a state of emergency, 16 people already dead. You sent a letter to him promoting the idea that the children had died not from measles, but from, quote, defective vaccine. You launched the idea that a measles vaccine caused these deaths. You are a very influential man. In fact, you are called the leader of the Disinformation Dozen. Multiple UNICEF and WHO, the World Health Organization, investigated this. They say the claims are false. It is not biologically possible what you claimed. And yet, ultimately, more than 70 people died because they didn't get vaccines. So my question is, do you accept even a scintilla, just even a sliver of responsibility for the drop in vaccinations and the subsequent deaths of more than 70 people? Anything you do differently?
No, absolutely not. After there were 2 incidents in which children died in 2015 and again in 2008. 2015, it was from the measles vaccine. That's what the New Zealand General Hospital found. The government of Samoa banned the measles vaccine after the 2018. I arrived in July of the next year after the ban had been in place for a year.
Mr.
And the measles,
understanding that you wanted to hold us to a minute and that I don't get to present all the facts and documentation.
But he's correcting you.
How about if we just decide to make entries for the record on exactly what the record shows about Mr. Kennedy's participation? And I think he's answered the yes or no question. He takes no responsibility.
Senator Warren, we will do that.
differently.
And Mr. Kennedy, and to all the senators, every senator knows that following this hearing, they will be able to ask you questions off the record and you will be able to put answers back onto the record. So please give that answer. I apologize that we're shutting you off for giving a full response right now.
Wow.
Senator Smith.
Wow.
We are way over time.
Thank you, Mr. Chair. So, Mr. Kennedy, you have said that you want to give infectious diseases a break for about 8 years. You spoke about this with Senator Cantwell. My question to you has to do with avian flu. Over 100 million birds called. The disease has spread to dairy cows, and there are now 67 confirmed human cases and 1 death. So, Mr.
This is like my panel on the Shade Room last night when they would just ask questions and talk shit and never let me answer. This is the same shit.
What do you think is causing the avian influenza?
I think the H5N1 virus is.
So that's good to hear, because in a recent book, I will submit this for the record because we don't have that much time. Mr. Kennedy has questioned the scientific basis for germs causing disease and the power of vaccines and antibiotics. to
I've
help
never
cure
questioned
disease.
that, Senator.
Well, I will submit that for the record.
Thank you. Senator Warnock, 1 minute.
I like the way you said that to the Baptist preacher. Thank you so much, Mr. Kennedy. Based on our conversations, it's my understanding that you
He is a
support work
preacher.
requirements in Medicaid. In 2020, President Trump approved a proposal from Georgia state leaders requiring Georgians to jump through a number of onerous bureaucratic hoops and fill out even more paperwork to verify work and get access to health care. I ask this as someone who represents a state that has not expanded Medicaid. Federal government, because of this waiver, spent $70 million on Georgia's Medicaid waiver. 82% of that went to administrative costs. The point that I'm making is that the folks that they're insisting need to work, 90% of those folks are working. They are caregivers, or they have a disability. Let me give you one example. A woman I think of all the time, her name is Heather. She's a traveling nurse from Dalton, Georgia, who falls into the Medicaid coverage gap. Heather experienced a series of small strokes, leaving her unable to work full time. She's dedicated her life to caring for patients, but now she can't afford her own medical care, out-of-pocket costs, because she doesn't make enough to qualify for tax credits to buy private insurance. What does Heather need? Does she need work requirements, or does she need access to health care so she can finally get healthy and get back to work?
The individual that you described would need health care and not a work requirement.
Thank you.
Thank you.
Thank you.
Thank you. And we are done with the questioning now. Mr. Kennedy, I apologize to you, to the audience, and to all of my colleagues to have to rush it here at the end, but we have a vote on the Senate floor that they're going to close in about 3 minutes. I want to thank you for appearing before this committee. You have been accessible to the members and staff on both sides of the aisle of the Finance Committee throughout a rigorous process. And I want the whole world to know that you spent hours in meetings answering questions outside of this hearing and providing documents and responses on issue after issue after issue. You've gone through the most thorough vetting process that any committee in this Congress puts anybody through. And I think that you have come through well and deserve to be confirmed. I would like to remind my colleagues that the deadline for submitting any questions for the record is 5 p.m. today, 5 p.m. today. And Mr. Kennedy, we ask that you respond to those questions as quickly as you possibly can. With that, I'm going to leave you in this room and run over to vote. This hearing will be adjourned. I still encourage the audience to be polite and respectful, no matter what side of the issues you may be on. And Mr. Kennedy, I look forward to working with you.
Thank you, Mr. Chairman.
We're adjourned.
Wow. Wow. So much wrong there. So much wrong there. There were so many things to correct. And the thing that's so scary is that those were senators. Those were your members of Congress. Those are the people who represent you, who are openly lying to the American people while calling the person who they are interviewing or interrogating a liar. There were just so many lies that it's hard for me. But let me just start with one lie that they told, because there was just so much and it was very hard to keep up with. I want to show you guys this here. This is Impoundment Authority, and I was actually happy that someone made reference to it. And I just did a quick Google search so you guys can understand what it is. So remember I told you that it was the Impoundment Control Act of 1974. So I was right with the year. It created, let me just read it for you guys. The Impoundment Control Act of 1974 created the procedural means by which the Congress considers and reviews executive branch withholdings of budget authority. But there was presidential impoundment. Let me show you. Hold on. Wait. Shit. I'm sorry. I'm messing up with the tech here. Okay. All right. Well, just look it up. The president, well, I know one of the things that Donald Trump was fighting for or was promising to do on the campaign trail was to bring back impoundment authority. Now, I don't know if they amended it or if they updated it or whatever, but impoundment authority is authority that the president has historically had, where they can take all of the excess money, all of the extra money that comes out of the budget, like the money that gets lost all the time, that disappears in the bureaucracy, take that money and put it back into the treasury. And so I guess the source of outrage is that all of the money that has been laundered through the government, somehow Donald Trump has written executive orders that are exercising impoundment authority, basically taking the extra cash, a lot of the money that you guys don't know about, like for the $10,000 toilets, or as we know, the $50 million that was going out to Gaza for condoms, or the $37 million that was going to the WHO after he withdrew from the WHO. It's things like that, because that's the money that tends to disappear. Now, I don't know how you feel, whether you're on the left or the right, but I believe that all of your taxpayers' dollars that kind of disappears into the abyss, it should be accounted for. And if there's no real reason to be spending that money on, you know, $20,000 toilets and $50 million for condoms in other countries, I would think that we would want to take that money and put it back into the treasury in order to lower the deficit. But to move forward on that, the way that they were just interrogating that man, not even interrogating, they were just throwing out wild accusations while simultaneously not allowing him to answer any of them, which I actually found like crazy. One guy, he asked him like 5 questions, and I'm glad RFK said that. He was like, yeah, but you asked me 5 questions. You didn't even let me answer one. I don't know how it is that they structure these Senate like confirmation hearings, but why are these people allowed to just say whatever they want to say? And when you try to answer or correct them in the things that they're saying, they can just shut you up and say, no, that's my time, and then just move on. Like, what is this? Isn't an interview, isn't the purpose for an interview to find out how the person thinks by letting them actually express their ideas, so you can allow the public to see exactly who they are and understand it? What I saw was a room full of Democrats who were intimidated by Rfk Jr., who we know is an excellent litigator, an attorney who has landmark cases, and this man has been doing this work for many, many years. They all were terrified of his responses, and that was clear. Because to me, and let's be real, if you get, oh man, this is the problem with politics, man. And this is the major problem that I have specifically when it comes to Democrats. They love to just say things to try to trigger the emotions of people, like that dude who was telling that weird story time thing about a woman having to have a late term abortion, and trying to frame it as if like that's like somehow you have states that are saying that if the life of the mother is threatened, you cannot have an abortion late term. That's not true. So I don't understand how these people are allowed to lie and twist facts or whatever and just say what they want to say. I know why they do it. It's to appeal to your emotion. They appeal to your sense of virtue in order to get you to either feel bad for thinking a certain way, or to get you to just hate someone else who doesn't think like you. And they're doing this while silencing the person who the American people want to hear from. Listen, whether you like RFK Jr. or not, weren't you interested in hearing what his answers were? Don't you want to hear this dangerous man so he can prove to you how horrible he is? Why didn't they let him talk? You're not curious about that? Why is it that the only people that actually let him talk were the Republican senators? And they say, listen, they didn't even so much, give him any answer. They were just like, you said blah, blah, blah. Can you explain what you mean by that? Isn't that what you want to do when you're interviewing someone? Asking them to explain what they're talking about? Why are Democrats always so afraid of words? It's the same thing. Listen, I did a panel on the Shade Room last night. It was great. I enjoyed it. But I noticed I wasn't given much opportunity to speak. And, and y'all know, listen, I call balls and strikes. But there was a lot of TDS on that panel. And the TDS was given, I'd say 80% of the time to talk. And I was not allowed to speak. So I'm just saying, this is crazy, bro. And when she called him out for this disinformation dozen, here's the crazy thing. I somehow have been associated with them through social media because I would assume so. Wink, wink. But I'm one of those voices that has been silenced. And I've noticed that of all the voices that have been silenced, especially on these social media platforms, in service to the Biden administration, the previous administration, the one thing I noticed is that these people, they always tend to acknowledge the things that they agree with on the left side. They acknowledge that some things can be right from people on the other side. But when they try to speak objectively and introduce just some logic and reason, they're silenced and they're called disinformation, they're quacks. Like renowned scientists, immunologists, virologists, like medical doctors. These people were silenced. They were censored, deplatformed. People had their licenses threatened for simply disagreeing with what the government told you was the science. For what Tony Fauci told you was the science, even though he gave you 5 different versions of science while reneging from one week to the next and then switching again back to the next one, then admitting that he lied to you because he wanted to protect the supply of masks, and then saying he lied. Bro, and y'all defaulted to that man over the people who were actually looking at the data. Wrong, sir, you are wrong. Okay, well, Chrissy, you have Trump derangement syndrome and you're one of those weird ass liberals. So let me do you a favor and block you out of this space. You're deported. Yeah. So when it comes to people like that who are renowned scientists, Stanford educated, Oxford, Harvard, the Great Barrington Declaration, if that would have been utilized, the whole COVID pandemic never would have happened, bro. Dr. Jay Bhattacharya and others, they contacted what's his name? Fauci. They contacted Fauci. They gave him the information. Next thing you know, everyone who agreed with that same Great Barrington Declaration, it's like right after Fauci took the reins of it and said, wait, hold on, emails went out. All the people who agreed with it suddenly just changed their minds, and Pfizer made billions of dollars. And Bill Gates, by the way, with Moderna. It's like, why are we this lazy? Homeboy brought up the late term abortions, right? Why is it, do you all ever ask yourselves why it is that Democrats seem to fight so hard for the things that honestly almost never happen? But then what they do is they use those outliers as excuses to create rules that open the door for some of the most egregious practices. I'll give you an example. And they love to do it based in subjective interpretations. They love to live in the land of subjectivity, playing with language. They talk about, oh, there's no laws in any of these states that allow abortions up until the moment of birth. Yeah, bro, there are laws on the books in states like New York. Where is this guy? Tim Walz, the weirdo from what state is he again? Is it Missouri? Is it Missouri or is it Minnesota? I think where's Tim Walz from? Is it Minnesota? I think it's Minnesota, right? Yeah. Look up their abortion laws. And if you look at the language, you will see that they remove certain language from they frame it in a way that it allows for it up until birth. There have literally been Senate hearings where laws were introduced by Democrats. I think her name is Tran. I think her last name is Tran, where she was literally saying, yes, you should have, while the woman is dilating right now, giving it up, they could still terminate the life of the child. Yes. Nah, not deliberate. And one of the things she left the door open for was even if it was emotionally disturbing for the mother, like if it would harm the mother emotionally to have the child, they could kill that baby. Even right there, even right there as the baby's coming out. It doesn't matter. That's egregious. And when Donald Trump was talking about, killing the child after birth, but, executing the child after birth, they played on semantics because, they were allowing for they were allowing for the child to die if the mother decided that she didn't want to keep the child. Let's say it was some complications or defects or something with the child, and she gave birth to the child, right? Or if it's a failed abortion. If the child survived, they would let the mother decide, well, do you want to let it live while it's here on the table or die? And they just allow it to die. So because they didn't execute it, but they let it die, is there a real difference? Why do we play in this language of subjectivity? I would argue because we find it easier to commit some of the most egregious, barbaric acts when we dehumanize people, when you take away their humanity. That's why the whole conversation about abortion is reduced to my body, my choice. Because when you say this is all about your body, you are erasing the actual life that is inside of you. That decision is not just about your body. How about the body of the human that is inside of you? That's an inconvenient conversation for y'all, because what you're doing is, because when you have to acknowledge that that is a life inside of you, a person in you, that you're saying you want to kill it because it's inconvenient 95% of the times, by the way, because 95% of abortions are elective. Look it up. But yet y'all out here arresting Black women for praying in front of abortion clinics. Now, you could be pro-choice, you could be pro-life, whatever it is. But when you decide that someone who is advocating for life is somehow taking away freedom, no, you're saying you want the freedom to kill somebody. What? That don't sound friendly? That don't sound clean enough for you? That's the truth. If somebody sees a pregnant woman and they rob her, they mug her, and they shoot her, and then and she's pregnant, she dies and the baby dies inside of her belly, is that person going to be convicted of murder, homicide, or double homicide? Is that double homicide or is it homicide? I'll wait. So we acknowledge the life of the child when someone else kills it. But you don't acknowledge the life of the child when the mother wants to kill it. You're hypocrites. You're hypocrites. So all I'm saying is, listen, embrace who you are. Just say what it is. I want the freedom to kill my unborn baby because, you know, it's inconvenient for me right now. I can't financially handle it. You know, I'm not ready. But I just noticed we never talk about, you know, the responsibilities that come before you get pregnant. Are we going to lie and say that abortions didn't just pretty much become contraception for everybody? They're literally giving you pills to just get rid of that baby. Like they're passing them out like Skittles, but they don't talk about the harmful side effects. Why don't you wear a condom? Why don't you take, what's that thing they call? The Depo-Provera shot? Why don't you practice all of these other forms of why don't you engage in the preventative measures before you get to that point? So that way you don't have to say, oh, the emotional trauma. Oh, but oh my God, you're forcing me to have a baby. Nobody didn't force you to open your legs. And for those, and in the situation when someone forced you to open your legs when it comes to rape, now I firmly believe, well, nah, because I, you know what, that's going to be another area too, because at the end of the day, I do believe in life. I believe every child has a right to life. So that's me. Now, some of y'all may not agree with me, but that's fine. You can, I believe that you can adopt a child. You know, they have all of these things. You have people leaving babies at a fire station or whatever. But as a parent, I have to acknowledge the right to life of my child. I remember when my son's mother was pregnant, we went to the hospital, and you know what? I'm starting to like see things different now, because when we went to the hospital, you know, they were telling us, you know, when you take the I forgot what the test is that you take, but they were like, yeah, it's a very high possibility your child has Down syndrome. I'm sure a lot of you women know about that test. I forgot what it's called. What's the name of that test? Does anybody know the name of the test? Where I think they test like and then where it's damn, I wish I knew the name of the test. But anyway, basically all they were doing, isn't it amniocentesis? I think that's what it's called. Amnio. But anyway, so everything they just kept pushing, you know, have an abortion, you know, yeah, you know, most parents, you know, we should, everything was about facilitate. Yeah. You should, you know, you might want to get rid of it. You know, we can't tell you, but, you know, it's very likely, high likelihood that the child is going to have, you know, be, what is it? Down syndrome. And it may be, you know, very inconvenient for the rest of your life. You got to make sure you know this decision, but you know, most people will terminate. So, you know, we can set you up to terminate. And I'm like, damn. How do y'all know? Is there anything we could do, like even to at least test? Like, why are you pushing this on us? So we went and did I think that was the amniocentesis. Isn't that where they go in and they test the uric acid, I believe? Damn, I wish my brain, I think that's what it is. But anyway, we took the test, and before we went in there, we were like, we're going to have the baby. But we took the test anyway, right? My son was fine. There was nothing wrong with him. So then I stepped back and I was like, damn, how many people have they done that to? How many young people going in to these doctors' offices, Black people specifically, have they done this to? Where at the slightest sign that there may be something wrong, they just push you to get rid of that baby. And then I just started looking around in certain neighborhoods. I see all of these Planned Parenthood centers in my communities, but then all of the fertility clinics, I saw them in white communities. Let's be real. Is it possible that there's an agenda? Is it possible that there's a reason why Democrats are always marketing abortions to Black people? I'm just wondering. Is it possible that, you know, at the DNC convention that they went to Chicago and set up abortion trucks right outside and vasectomy trucks? Come get your free abortions and vasectomies. Like, This is our civil rights struggle? Like what? Like, are we okay with that? And then when a black person calls this shit out and says, "Hey, it feels like there's an agenda here. I want to fight for the nuclear family." Shut up, Coon. Shut up, Uncle Tom. And then you get these trolls that come into the chat, you know what I'm saying? Say all of this dumb shit to you. But anyway, let me land on what I wanted to talk about, because they did use COVID as a way to, well, they lied the whole time. But they tried to present, I mean, RFK showed, well, they brought out these statistics, right? Where they were saying that basically, I think he said like 80%, oh no, 90% of Americans went out and they took the jab. We know why. It's because of fear, right? We know that fear is what led, well, initially 90% of people, right? But then today, when you talk about all, remember the boosters, remember it came along with all them boosters and shit. Now, when it comes to the 8th booster, I think now that the CDC is recommending, what percentage of people are going out to take them? What people are against? How many people are against it and not doing it? As a matter of fact, 77%. And I think the number was actually 80%. I'm sorry for those who were like pro, pro COVID jab. It was 80%. 90% took it at that point in time because they felt they were terrified. But the overall sentiment was like 80% of people, especially in blue states, who were like, yeah, we want it. Today, it's 77% who are not taking that shit no more. And they literally tried to present that to you, the American people, just now, as if, yeah, RFK, you're part of the disinformation dozen, and so many people were saved, and look what you did. Ignoring all of the harm that was caused to the American people as a result of that thing. And not even the American people, across the world, because sadly, the CDC has been last in every instance to report the adverse effects of the COVID-19 jab, behind every other nation in the world. That's facts. So while other countries are banning it, they're still promoting that shit to you, hard body. And now you got RFK Jr. saying, look, we want a healthier America. We want less chemicals. We want better science. We want to actually do the science, as opposed to silencing people, other scientists who disagree. We want good science. We want the gold standard in health. How can you disagree with that? Bruh. Why is it so easy to propagandize you Democrats? Democrat voters, why is it so easy to propagandize you? Do Republicans engage in propaganda? Yeah. But we know the entire social environment in this country. I mean, let's be honest. This society has just become so indoctrinated with white liberal, fake progressive, super leftist policies that, in this instance, to me, Republican, conservative doesn't even matter right now in the conversation. Because I'm a lifelong Democrat. And because I decided that I wasn't hold on one second. Yeah, boring. If you're bored, why are you in this space? Why don't you, let me help you out. Okay, I deported you from this space. So go ahead and be bored somewhere else. And that's what Democrats do. That's what liberals do. When you actually give them facts, they try to find some way to insult you or add homonyms. You know what I'm saying? Like, how about you correct me? How about that? That's why liberals don't like speech. That's why they censor you, because they hate being corrected. I like being corrected because it teaches me. I learn from it. I can grow. I'm better equipped with information. So now next time I go and have a conversation or even a debate, I'm better equipped. Why would I double down on being wrong? Why would I do that? Oh, ego, hubris, ignorance, fear, embarrassment, regret, cognitive dissonance. So many different reasons. Which one are you? It's a shame that this is where we are in society. Why? Oh, wait, this looks like a good question. Let me see. Why do we want mandatory vaccination as the Dems want us and say they are safe, whether they are, wait, what? Whether they are or not? Okay, I got lost in the second part of what you were writing, but I guess the point is why do we want, honestly, why do we want mandated vaccine? Why do we want any mandates on what you must do with your body? And I know a lot of times you guys like to conflate, oh, but with abortion, my body, my choice. But it's not just your body. But even with that, there's no mandate on you. There's no mandate on what you have to do. No one's telling you what you have to do with your body. They're saying don't do that to that other body inside of you. But y'all preach about my body, my choice, right? You fight for choice when it comes to abortion. But then you push mandates, forcing people to take an experimental injection that they don't trust. How does that make sense? How do you justify that? Does anyone have an answer for that? What is wrong? What is wrong with y'all? And then you get these emotional, social justice people and pundits and these media personalities on the left who are always trying to demonize it. Oh, those conservatives or MAGA, because that's the thing they always use. Those MAGA extremists, they're hateful, they're racist. And when I correct them, oh, you're MAGA. You're a slave, you're a sellout. No, I'm not MAGA. I just think for myself. Yeah, everything you're saying, you sound just like Trump. No. Trump sounds like me because I think for myself. In whatever instance you're referring to, Donald Trump just may happen to sound like me, just like a liberal may happen to sound like me in a moment of clarity. But I have agency over my own thoughts. I don't grant authority to some political party over the way I think. Why is it that whenever I give you new information or I correct you, oh, you're one of those people? Yeah. That's labeling people. When you brand people, it's easy for you to say, no, I don't have to listen to you. Nah. I don't want to hear you. You're evil. You're a bad person. I don't have to. What is that shit? 1 second. I keep forgetting about this damn camera. Yeah, I'm back. So you get the point. Anyone who's afraid of hearing information, like everyone that was in that, or every Democrat in that Senate hearing just now, including Bernie Sanders, you can't trust those types of people. Always ask questions. That's the thing. You got to always ask questions. Anyone who discourages you from asking questions is an enemy because they don't want you to have more information. Now, what type of people don't want you to have additional information? I would argue that those are people who do not have your best interests at heart. I would argue that those are people who want to control your outcome. Why should I be? And then the crazy thing is, y'all were out there begging for them to censor information under the guise of misinformation. continuing to beg that your freedom is taken away from you in exchange for protection. But what is this protection from? Words? Are you so dumb that you need your government to decide what you're able to read, listen to, what information you're exposed to? Are you so slow that you must be managed by your government, who you deem to be the arbiters of truth? The same government that has been caught lying to you over and over and over again? That sounds like willful ignorance. When are we going to get it? When are we going to stop regurgitating talking points that have been fed to us by people who don't have our collective best interest? When are we going to start actually talking to each other? Is it possible that you've been lied to? That's my question for my Democrat voters out there. Is it possible that you've been lied to? And if it is possible, my question is, why aren't you willing to listen to anything, any information, any additional information that is provided to you? You know, admitting that you're wrong is actually a sign of strength, you know. You got to be open to changing your mind after being introduced to a new perspective. That's a true sign of strength, because it shows humility and it shows the ability to self-correct. Learn more. Of course you could be wrong. Anyone could be wrong, but guess what? You'll never know if you're not allowed to be exposed to new information. That's entirely my point. The solution to so-called bad speech, hate speech, is more speech. Listen, if you're a racist and you're saying something terrible, I want to hear you. I want to hear you say it, because I want to be able to identify you. That goes the same for all you people who are out here speaking this protectionism. Oh, censor them. Oh, protect all you. Listen, bro, there's a lot of grifters out there in the social justice arena. I want y'all to continue to speak up and regurgitate the lies, because I want the community to see you for who you are. A lot of y'all are crashing out right now, and I love it, because I read your comment sections. Ain't nobody riding with you no more. And you continue to double down. You know why you keep doubling down? Because you have not invested in anything else. You've doubled down so hard on the wrong side of the fight that you're incapable of seeing the other, incapable of even just objectively saying, wait a minute. Why can't you can't read the room, bro? You can't read the room. Consider the possibility that you are wrong. You can hold tight to your beliefs. You can defend them, fiercely. But if you're wrong, bro. You still have to be open to the possibility that you may be incorrect. That's why I always say it's better to listen first before you speak. But a lot of y'all are just talking, and then you're turning off your comment section. I see y'all doing that shit, especially on Instagram and X. Y'all talk your shit, you talk all that hot shit, and you turn off the comment section. I know why you do it. Because when people like me get in that comment section and correct you, it exposes you. But I don't even have to do it no more, because a lot of y'all got me blocked. I know that. I get it. But the average American person right now, the everyday people are getting in that ass. And I love it. The Roland Martins, the DL Hugleys. Oh, I see y'all. I see y'all getting cooked every minute. And I love it, because it tells me that my people are waking up. So I know a lot of y'all are very attached to the Democrat, party, and, some call it the plantation. I'm not even going to resort to the insulting people. But if the only reaction you can ever have to someone respectfully and intelligently correcting you is to tell them to shut the fuck up or try to say, oh, you're a this or you're a that, or you're just exposing your own weakness. You're exposing to people why you cannot be trusted. Logic rules all the time. Facts over feelings every single time. So that's all I had to say. I didn't even plan to get on here. I just wanted to go here and come up here and chat with y'all. But yeah, I just went straight because I saw the hearing going on and I was very interested in seeing what RFK had to say. I thought he handled himself very well. I thought it was it was an abhorrent display on the part of the Democrats in that room. I didn't see the whole entire thing because I came in, I guess, halfway through. I'll watch the rest to see if there was anybody who was reasonable. Raphael Warnock, I thought he was an embarrassment to his state. But I'll let you guys look for yourself because, bro, it's crazy. I'm echoing on X. Am I? I don't know why I'd be echoing. But yeah, but anyway, I'm getting ready to drop anyway. So listen, y'all. I appreciate you guys coming on here and just listening to me for my little rant. Maybe I'll come on later and do like an official episode. If I do, I'll just put the word out. You know, I'll put out a post. But yeah, you can always follow me on X at Tony L Talks. And also, I don't know. I'm not sure if TikTok is giving me my thing back. It looks like they're starting to give me back my views because on TikTok, I'm like crazy shadow banned. But if you want, you can follow me right there on TikTok at Tony_Talks. That's Tony Talks. Or just type in Tony Talks and you'll see my big head. Just follow all of the accounts because I'm on my 14th account now because I constantly get banned for telling the truth. So anyway, I appreciate you guys. I look forward to more access to you. For you guys, if you have any questions, always feel free to hit me up. You can hit me up on X. You could DM me on any of my social media platforms. And, maybe ideas. You might want me to talk about something or you might want to come up and join the conversation. Yeah. So, but here's the thing. If you're going to come on the podcast and you're going to come join the conversation, I need you on camera. I'll tell you that now because I like to build a sense of trust with the audience. And especially on these social media platforms, all we're seeing are trolls. And I always try to remind people that, look, at the end of the day, social media ain't a real place. So sometimes you can't just get too caught up in the arguments with the chat or arguments with the comment section because they're there to derail the conversation. They're there to try to trigger those who are paying attention to you in order to just kind of derail the conversation, right? They need the chaos because the more people listen to truth, the more armor they are building up to protect them from lies. So the liars are going to come in great numbers in order to try to drown out any truth that you speak. But the fact remains, when you tell the truth, it will always drown out the lies that are being told. That's why when you're a truth teller, you don't need a good memory and you don't need any assistance. I don't need any assistance when you're telling the truth because the truth is always going to outshine the lie, right? But guess what? A liar will always need the truth to be silenced. So think about it. When you think about the people who are censoring you, when is the last time in history that the people who were censoring you were the good guys? I bet you can't name one. And with that, I land my plane. Thank you for coming on and checking me out. And we need to talk with Tony. I'm your host, Tony Lindsay, and I'll see you next time. Peace.